All right. Hi, everybody. My name is Brook Buettner. I use she, her pronouns, and I am the Executive Director of the Regional Crisis Response Agency, RCR. We call it RACER. So as I walk through the presentation, I'm going to use the kind of nickname RACER for the agency that I lead. The RACER agency is what I call a behavioral health first response agency. And I'm delighted to be here to talk about the work that RACER does, along with what's kind of unique about our setup and what I think other programs and agencies might be able to take away and could help them create programs of their own. My background is that I'm a social worker. I have worked with folks experiencing chronic homelessness, chronic behavioral health conditions, and intersection with the criminal legal system for most of my career. I spent some time at county government, working kind of on the funder side and on the policy side. And then about 5 years ago, moved over to run a previous iteration of the RACER agency doing diversion, doing true co-response diversion. I'll talk a little bit about that as we move through. But the RACER agency is a municipal services organization incorporated by an interlocal agreement. And I have a little image on the screen of the interlocal agreement, but it is a very thick document with a lot of legal language that incorporates the RACER agency as a nonprofit under Washington state law and as a municipal services organization that provides first response services for the 5 principal cities that are signatories to the interlocal agreement. And those cities are Bothell, Kenmore, Kirkland, Lake Forest Park, and Shoreline, Washington. Our geographic area covers the north of Lake Washington, so just north of the city of Seattle. So we're kind of suburban cities north of Seattle. We share a lot of the challenges that the city of Seattle has. We have, the growing homelessness that our county is experiencing, along with the opioid crisis. And our first response agencies, and especially our police agencies, about 7 years ago, started thinking about how they could engage in alternative approaches for people experiencing crisis, experiencing homelessness, experiencing behavioral health and substance use issues. So the early days of this program was under leadership of 5 police agencies in our 5 cities. And then in 2021, 2022, our 5 cities started thinking about how could this be a more sustainable model. And there was some political conversation. Obviously, the activist community had started looking at alternative programs and thinking about how we could do these more sustainably. And so the interlocal agreement pulled leadership out of police and placed it within the city structure as a nonprofit municipal services organization, but under the governance of our 5 cities. And this is an important designation. A couple of things that I'll talk about as we walk through in that flow from being a municipal services organization. One is that we are truly doing first response, and first response is kind of the purview of municipalities. And another is that we are able to be a part of the cooperative municipal risk pool for Washington state. So our insurer is the Washington City's Insurance Authority, and the other members of that cooperative risk pool are other municipalities and cities. I want to talk a little bit about the path to get to where RACER became an agency under an interlocal agreement. This is a picture before we even had our logo at our 1-year anniversary about a year ago in mid-June of 2024. And it was a celebration of the many folks across our 5 cities and across our state, really, that had a part in creating this agency. And I want to really go down this list and talk about how important it was that we had folks from all different sectors coming together to think about what is our long-term vision for our community. Folks with lived experience were at the table in designing this intervention from the very beginning, even when it lived very early on in our county sheriff's office. One of our bigger cities, Shoreline, it has contract law enforcement through the King County Sheriff's Office. And it was like the chief of Shoreline Police Department who very early on said, hey, we need something different, and brought in NAMI, along with other folks in the community that had family members that had experienced crisis, and were at the table very early in designing an alternative. Law enforcement has also been a huge stakeholder. Our 5 police agencies, I call them early adopters, because very early on, our 5 police agencies welcomed the idea with open arms. Our 5 chiefs were immediately open to the idea of having an alternative response. And there were times when patrol deputies and patrol officers had a little bit of suspicion of it, but a lot of our work has been building relationships and helping other first responders understand that this is augmentative and not taking away from their body of work. And that where it is, it's calls that they may not have necessarily been the right resource for anyway. So in our community, law enforcement has been a huge ally. Fire and EMS is another player that has been at the table from the very start. At this point, we have 2 regional fire agent authorities. Early on in the process, we had 3 and 4. There has been some move toward consolidation, but it's really important to us at RACER that both law enforcement and fire EMS are close partners, because we are fashioning ourselves as another tool in the first response toolkit. So a third kind of arm or branch of the first response system. Community activists and our advocate community was a really big part of the process, especially after 2020, when there was a huge surge in people being active and understanding and thinking about issues around policing and around crisis response through the 911 system. This is something that I'm really proud of, that we went from early in 2020, a lot of activist groups across our community questioning the role of police and kind of the voices of the defund police movement, that then came to the table and started talking with our police leadership, with RACER in its early iteration, to say, hey, we kind of have something, an alternative already going on. How can we build this? How can we blossom this into what our community wants and needs? And we came to a point where everyone from the far left that were talking about alternatives to police, to the elected officials, to our police chiefs, all have a common vision that in our community, when someone calls 911, they get the resource that they need. And the way that we get there, the car that the resource drives to the scene in, may change over time, but that our commitment as a community in North King County is to people that are in acute crisis getting the resource that they need. And again, that's something I'm just really proud of in our process, that we have been really strong on consensus building, on coming together and talking about where is it that we want to go, building enough trust and enough relationships that these different stakeholders could be in conversation. So behavioral health partners have also been at the table. In Washington, we have 988 was rolled out about 2 years ago now this summer. And so always thinking about how can 911 and 988 deployed mobile community-based teams work together. How can those 2 systems deploy effectively together? We've always worked closely with our funders. Obviously, that's a must. I'll talk a little bit about that later on. Elected officials have been some of our biggest champions. And because we're a municipal services organization, our 5 city councils will vote every biennium on our budget as principals. And their buy-in and their support of this has been absolutely pivotal. When I get to the budget, I'll talk about how city dollars play into the way that this model is funded. Prosecutor and city staff were also important stakeholders early on in designing the previous iteration of the RACER program. The prosecuting attorney's office for our county was involved to think about this as a true diversion. Our community in the last 10 years has really leaned into diversion. We have, we're the birthplace of LEAD in Seattle. We have come a long way in 10 or 15 years from where prosecutors were naming divertible charges to where now the first response system is choosing not to arrest, because having a crisis responder come or having someone go to a crisis facility is seen by first responders as a preferable alternative. But in those early days, it was really important that the prosecutor was at the table thinking about this as a diversion. So the goals of the RACER agency, as defined in our interlocal agreement, are to provide crisis response, reduce police response to behavioral health calls, provide alternatives to police as the primary response, and reduce strain on police and fire by reducing repeat calls. Largely kind of big picture, I would say our goal as an agency is, again, that people in acute crisis calling 911 get the right resource at the right time. And there's understanding across stakeholders and across our community that sometimes that resource is going to be a firefighter or an EMT. Sometimes that resource is going to be a sworn officer, and sometimes that resource is going to be a highly trained mental health professional crisis responder. And I have pictures on the slides throughout so you can just see our folks in action. RACER crisis responders are responding to in-progress 911 calls. In the next slide, you'll see a graph, but about half of the work time, the encounters that we have with folks in the community are through in-progress 911 calls. And what they're doing is high acuity de-escalation, some immediate resources. So I'm talking about things like a water bottle, even a tent. We have some cell phones and transit cards, referrals for services, and then some follow-up with folks. But the follow-up is always coming second to the ability of the crisis responder to be on the board for 911 calls. So our primary responsibility is in progress 911 calls. And then when they're not on a call, the crisis responders will continue to reach out and follow up, making sure that folks are getting connected to the community of care with the idea that they are not falling into crisis again, ideally. So figuring out what's missing that this person got to the point of a 911 call, what can we bring to bear and tie in for them so that they don't come to that point again. So I have a little graph from 2024. This is the first year we've actually been able to gather the data of how an encounter comes to a crisis responder. So you'll see that about half, that green piece of the pie chart, are in progress 911 calls. And for the last about year and a half, our crisis responders have been on radio air with on police channels across our 5 cities. We have 2 PSAPs and 3 channels that we're operating on to make sure that we're catching those in progress 911 calls as they come in. And our kind of MO right now, our SOP, is that we are self-attaching to calls. We as a community are still trying to figure out that puzzle of triage and decision trees of when an alternative responder is dispatched in lieu of a sworn police officer. And then we do some follow-up. That little slice of officer referral represents the period of time when there is no crisis responder available. We have crisis responders in our community 7 days a week, about 6 a.m. to about 1 a.m. So we do have that little 4 or 5 hour slice of time where a crisis responder is not available. There are also moments where a crisis responder is tied up on another higher acuity call and is not, or a pair of crisis responders is tied up and is not able to respond to another incoming call. It's my hope that that little yellow slice will shrink over time as we move toward 24/7 access and as we expand and figure out how to better spread the peanut butter of the crisis responder resource across our region. Our primary challenge at this moment internally to our organization is how do we deploy across air channels and especially across PSAPs. With 5 cities, there are 2 that are King County Sheriff's Office contract law enforcement, and all of their dispatch happens within King County Sheriff's Office communications, and then 3 whose dispatch is done by NORCOM 911, which is another organization that's similar to RACER, set up by an interlocal agreement between a number of cities, police agencies, and fire agencies that does the call taking and dispatch for a big swath of our region. And we're really lucky that that entity exists because it also aggregates CAD data. So I'm getting a little into the weeds here, but in our community, the one PSAP, one of our 2 PSAPs, operates a CAD aggregator that allows us to see calls coming in real time, in addition to being on radio air. So that's helpful operationally. So right now, I have 13 full-time crisis responders, well actually 12.5 FTE crisis responders that are out there in my 5 cities, 7 days a week, most of the day. All of the crisis responders are mental health professionals. They are also, I'll get to this one a little bit later, but they are also City of Kirkland employees, one of our cities that operates as our administrative sponsor. And so the folks that are coming to work for RACER are extremely experienced and skilled mental health professionals with years and years of experience in the field. We're really drawing the best of the best because we are union city employees with an excellent wage and benefit package. So I think that is something, when I think about what are the benefits of the way that RACER is incorporated, one of them is that as a municipal services organization with a large city as our backbone entity, these are government jobs with a pension, with excellent benefits, with excellent wages. We are able to draw and keep the best MHPs in the region. So across these 5 jurisdictions that we're serving, we have a population of about 230,000 people. It swells to closer to 250,000 during the day because we have a university campus, and we have one of our cities has a whole bunch of kind of industrial space that brings in a lot of workers. And I want to note that our smallest city has just 22,000 people. And so when we're talking about the benefits of this model, a tiny city like Kenmore, Washington, with 22,000 people could not offer their citizens this service without consolidating and cooperating with other cities. One of the kind of goals of the Racer Agency and one of the benefits of this collaboration is that we're moving toward being a first response. And there is a lot of operational and financial and all sorts of depth needed to provide a true first response. It's a lot more staffing than one person at a time because you have to have people available for vacations and days off. And as we move toward that, even for our bigger cities, it would be tough to do that without collaboration because just of the cost alone. So I'm going to talk a little bit about the economies of scale in having a 5-city interlocal agreement and collaboration. One of them is insurance, as I mentioned. Another is our database that just for folks that run programs, you know that this can be a real bugaboo to try to figure out how to manage your data at the operational side and then how to mine it and do QI. And a tiny program in a small city would not be able to do that. The city of Kirkland, which is our biggest city, does provide backbone support for some of the things that an agency with 13 employees would not be able to do, like really manage our fleet. We do have vehicles that the crisis responders respond to the scenes in. I'm just going to go back to this slide so you can see one of our vehicles. And it was really important to a lot of our elected officials and our activist community that crisis responders arrive on the scene in a civilian vehicle, not in a cop car, essentially. And again, to go back, a previous iteration of the program was True Co-Response, where the social worker was riding in a police car in the way that the programs across the nation define co-response, was riding to the scene in a police car. And now we are, like I said, self-attaching to the 911 calls and generally deploying in crisis responder vehicles. So again, to go back to the economies of scale, fiscal backbone, fleet, human resources, and IT are all functions that would be challenging for an organization our size. We want to be able to focus kind of everything on the operational side. And we do pay, as an agency, we pay the city of Kirkland administrative services fee. That is significant. So we're paying for the services, but we're getting a much, much higher quality than we could if we were trying to do all of that internally, maybe with an office manager or with, a single staffer to do all of those backbone functions. And I think that the having a big city that is doing those functions for us kind of elevates the quality of what we're able to do. The governance of the Racer Agency is another thing I think is kind of unique for the 5-city interlocal agreement collaboration. My position is executive director, and I respond to an executive board in the way that a nonprofit is ultimately governed by a board of directors. And the executive board for the Racer Agency is made up of the city managers of the 5 cities. And the city managers, of course, report to their city councils. And so the governance is really ultimately through the elected officials and the people. And I think that's pretty cool and pretty unique. We also have a principals assembly that is a table that seats one elected official from each of the 5 city councils. And their role is really to be a liaison between the agency and the city councils. And that's important because our councils enabled the signing of the interlocal agreement and approve our budget every biennium. And so the cities pay in on a per capita basis at the pleasure of the council to make the agency run. We also have an operations board that I'll share just briefly because I think it's pretty cool, serves as the crisis continuum of care for our region. It seats the public safety chiefs, myself, our PSAPs, and then leaders from our behavioral health space, including our emergency department that takes most of our invols and psychiatric emergencies, and then our fairly newly opened crisis triage facility that is just coming up on a year in our community and That table allows leaders from across these sectors to say, hey, how are people moving through the crisis system? Where are they falling through the cracks? What can we do to improve the continuum? And then finally, I always point out, because I'm really proud of this, we have a community advisory group that is specifically made up of folks with lived experience in the behavioral health system, and even more specifically with 911 and crisis. And I think that's pretty unique across the country. Of course, lived experience has become kind of a buzzword over the last 10 years, but where we really zero in is folks that have had to call 911 and had to have that interaction with the first response system to tell us, how can we do it better? How can we make sure that the service that we deliver at the moment of 911 call is what people need in our community? And the Community Advisory Group has been instrumental in everything from the design of the Regional Crisis Response Agency, ILA, all the way to our job descriptions, what folks wear when they show up on the scene, how we evaluate employee performance. So I really try to bring in that wisdom to every element of how we're providing services. So to move on from governance to our budget, I just have the numbers on the screen. 2025, it's a $3.36 million budget for the program. We're about 30% grant funded, and the rest is paid by our cities. And one of my big jobs is to bring in additional funds for sustainability, bring in grant funds to offset the cost for our cities. But even at that per capita allocation paying for the $3.36 million program, it still is a pretty good deal for our cities. Like I said, it's per capita. There has been some discussion of looking at utilization as part of our participation model. But just to share for any municipal leaders that may be watching, that our cities are taking these dollars from, in some cases, ARPA, in some cases, opioid settlement dollars, in some cases, public safety levies. In 2 cities, public safety levy funds are used to support this body of work. One city actually did a public safety levy lid lift vote a handful of years ago, and their messaging included this alternative as part of their public safety system. I thought that was really significant. And that just goes back to why it's so important to have great relationships with the elected officials, with our city councils, as well as visibility for community members. That's another thing that we are still kind of trying to figure out. How do we educate the community more broadly that in North King County, when you call 911, these are the things that are available to you? Still working on that, but I think that's going to be really important moving forward so that people are willing to pay for it out of the tax dollar in the way that they're sometimes excited to pay for fire services or for police services and public safety. I am just going to include a quick story here and then move on to some data. This is a face blurred picture from body cam of a crisis responder who responded in the Lake Forest Park community to a young person who was in crisis and her mom. And this is the reason that I really like this. I'll tell the story just so briefly, but I really like this one because the police sergeant who sent me this body cam still told me that this would have been a physical use of force if not for the crisis responder. And to hear that from our police partner was really meaningful to me. In this case, it would have been somebody that had to be detained for her own safety, physically detained, but they do consider that putting hands on. And the crisis responders' skill in high acuity de-escalation resulted in this scene ending with the young woman walking off peacefully and getting services rather than getting physically detained by a law enforcement officer. So anytime I hear those little stories, it just warms my heart that they're out there doing what they're supposed to do and that the police are appreciating it. That in this case, they were so relieved that they didn't have to go hands-on with this young woman for her own safety. So a little bit of data for the program. In 2024, our program served about 1,800 individuals during close to 5,000 service encounters. The reason I think this is significant is that, one, we're doing a lot with a little. We are seeing a lot of people that have called 911 in crisis. So all 1,800 of those individuals at some point called 911 and had the first response system intervene in their lives, had the worst moment of their lives and got the right resource at the right time. It's also significant to me because we did an analysis of 2023 data for potential call types that would be appropriate for a crisis responder. So things like coming in as a suicide, as a behavioral health, homelessness related, in some cases, APS or CPS, where they could benefit from a crisis responder's presence. And a very low number, because we don't know all of them, but it was about 5,000 calls for service across our jurisdictions in 1 year. And to me, it's very promising that we're getting toward like 1/3-ish of the number of calls for service that would benefit from a crisis responder are getting a crisis responder in essentially year 2 of the model. Kind of year 2.5, we had some antecedent work, but we've really been implementing this for about 2 years. And so that looks like success to me. It also feels like I can wrap my arms around it. When we look at homelessness in King County, for example, it's like 20,000 plus individuals sleeping outside every night and 100 units of housing going online. And that sometimes can feel really overwhelming and hopeless. But then I look at our numbers and say, people that call 911 in acute behavioral health crisis, with that number, maybe 5,000 a year, we could potentially get there as a community, especially the way that we're going, and especially given the fact that our entire community is so supportive of this body of work. And then I'm just going to share real briefly some outcome data. This is from our county, who's one of our funders, through a 0.1% sales tax levy funds, a good portion of our program, and also person matches our data to outcome data. And over the years, and this is for actually previous iteration of the program, but we saw a significant reduction in adult jail bookings after a program touch in the 2 and 3 years after a program touch, significant reduction in crisis services events. So that tells me that we are connecting people to the right services, and an increase in engagement with mental health services. So all of those are really promising outcomes. If I do another presentation on how we do data, I'll talk a lot more about that, but I'm going to stop sharing now and just get to some final themes. That our model has only improved since the folks had 2 to 3 years post intervention, and so I anticipate that as we move forward and we get data that is more specifically about folks that have been touched by the RACER agency since the ILA was signed, that our impact will continue to be positive. Generally speaking, I want to share the top takeaways for me, for folks that are considering how to provide behavioral health first response services. I don't call it co-response and I don't call it alternative response, because I don't want to get dragged down into a model where when our community is doing behavioral health first response. So I talk about it as people calling 911 get the resource they need at the right time. And sometimes that comes in a crisis responder car, 2 crisis responders in their own vehicle. And there are sometimes when they hop in a police car because they're going to be able to get there faster. And when it's a moment when somebody is truly in high acuity emergency, that's important. And we are working toward where sometimes it'll be just the 2 crisis responders and not a police officer or a firefighter. So that's kind of our next challenge as a community. But to do this work, we are able to do it, I think, most importantly, because of the consensus building and collaboration that we've had across stakeholders. Like I talked about, from our activist community to our police chiefs, to our elected officials, to even the state. And we all share a North Star. And I think our agency has enough trust that we can say we're not to the North Star yet, but we're on our way. We're on the path, and it takes some time and it will take some distance, but we will get there together. I think another important takeaway is that our smaller communities needed economies of scale and will need economies of scale to get to the depth that's required for first response, for true first response. Another takeaway theme is that in Washington, we just passed legislation that defines co-response specifically as alternatives that live within the first response system. And that's kind of one of the reasons I don't like to get tied down in the terminology, because what we're talking about is a little bit different than how co-response is defined in other states. But more broadly, and speaking more big tent, we're talking about alternatives to a badge and a gun or a firefighter EMT within the first response system. And that's also a little different than what's going on in 988, because first response is just a little bit of a different animal than mobile dispatch crisis teams. And in Washington, that legislation stakes a claim that our first response system includes high acuity behavioral health emergency. So people experiencing high acuity behavioral health emergency should get the resource that they need at the moment that they call 911. And in our community, we're doing that by collaboration between 5 cities. And I'm just so happy to share that. And I'm always happy to share our interlocal agreement if that's helpful, any of our documentation. I feel like this is a very franchisable model and a very uh, customizable model to what a community needs. But the bones of it are that 5 cities believe that their citizens deserve an alternative when they call 911 and are putting the resources into making it happen. And that is all for today. And I appreciate everybody taking your time to be with me and hope to hear from you.